All ready to go?
Yeah, well, I've now, Chair.
Great. Thank you all. Well, good afternoon, councillors, ladies and gentlemen, anybody who's watching on live stream. Welcome to the Health and Wellbeing Overview and Scrutiny Committee on Tuesday, 3rd of November. As I said, this meeting is being live screened. I think today we have Veronica Jones here, Cabinet Member. Richard Dodd was here, but he's just given his apologies. He has to leave for another meeting. And I think Glenn Sanderson was trying to get here, but I'm not sure whether he'll make it because he has another 2 or 3 meetings today as well. But if we can crack on with the agenda, please. Normal sort of house. Yes.
Chair, I don't know if other people are having problems, but I'm really struggling to hear you, and I can hear others. So I don't know if your microphone's a bit low or something.
I will see if I can just. Thank you for that. How is that, Susan? Is that any better? Thank you for that.
Thank you.
Right. Again, as I was saying, just normal sort of house rules. If you want to take part in any of the debates, if you can just put your hand up either virtually or electronically. If I don't catch you, I'm sure Heather or Chris will let me know. If we can get on to the first part of the agenda, which is apologies for absence. Heather, do we have any apologies?
Yes, I've got Mrs. Dealally, Chief Executive.
Great. Any from the floor? Councillor Hutchinson?
I'd better put Councillor Armstrong's in because I've just tried to call her and there's no reply on a mobile or a landline, so I better put hers in, please.
Right, thank you. I think Eileen must be having problems because she's normally very reliable.
Chair,
sorry, yes.
Jim Brown wishes to speak.
Oh, it's just apologies from Liz Morgan, and I'm here on her behalf.
Yeah, thanks, Jim. I was going to mention that when we came to your bit, but thank you for that. Minutes. We have the minutes of the 21st of September. Councillor Rickaby was in the chair. If we can somebody propose that they are a true record? Councillor Hutchinson, and a seconder for that? Councillor Rickaby. Are there any parts of the minutes which anybody wants to discuss, or is everybody happy with that? Great. Minutes of the meeting held the 6th of October, myself and the chair. Can we have a proposal for true record, please? Councillor Rickaby, and a seconder, please. Councillor Hutchinson. Are there any parts of the minutes that anybody wishes to discuss? Oh, excellent. Thank you very much for that. Disclosures of members' interests. I don't have any, and nobody seems to be putting their hands up. Excellent. Next we go on to forward plan, which is Appendix A in your bundle.
Thank you, Chair. The forward plan's just there for members to note. There is one item on there, the discretionary grants for adaptations to housing for disabled people, which is the report that is coming to this committee in this meeting for the committee to pass comment on before going to Cabinet. Thanks
for that, Chris. Cabinet reports for pre-scrutiny, item number 5. And I think Veronica, Councillor Jones, would like to introduce this before we go to Neil.
Thank you, Chair. I just wanted to say a few words, really. This is, well, it's very positive report. It's really to provide more flexibility. The facilities grant comes directly from the government. So it's not council money, it comes from the government. And this will provide more flexibility to how we make people's homes fit to meet their disability. Northumberland doesn't currently have such a policy, so this really is to put it in place. And I'll let Neil take you through the actual details. Thank you.
Thank you, Councillor Jones. Neil?
Yeah,
Aye.
thank you, Chair. Thank you, Veronica. Yeah, so just as a brief overview of this paper, I mean, in case people aren't aware, hopefully most are, Disabled Facilities Grant as a scheme's been around since around about the 1990s. And as Veronica said, we get an allocation every year from central government. That allocation has been increasing a little bit over the last few years as the government's pushed more resources into this area, and we now get around about 2.9 million each year to use for this purpose of grant adaptations to people's homes and to enhance housing generally for disabled people within Northumberland. The scheme itself is quite restrictive in terms of what you can actually do with the grant. I mean, clearly it's targeted at improving living environments for people within their home. It can range from things through from sticking a ramp for wheelchair access out the front of the house, through to disability adapted showers, right through to full extensions and conversions on houses as well. Because of the latter part of this and the more expensive adaptations that can be undertaken, the threshold grant that is allowed to be given is £30,000 per year. And for anybody who's had an extension on the house, they'll know that, you know, the cost of those can exceed that amount these days. So because that grant allocation total hasn't increased for quite a number of years, we have found that there's been more cases coming forward of people that we're struggling to assist with grant because they get near that cap level, and that's been the trigger. I mean, we've been floating around the idea of bringing this policy forward for a while, but it's becoming a little bit more urgent because we're seeing more of those cases coming through. They're not very frequent, I would say. We need to be realistic about that, but they do happen and they are a problem, and it can affect people's lives. So broadly, what we're looking to do here is bring in a discretionary scheme, and we have to, if we want to implement it, we have to get that approved through council and we have to advertise that scheme. Otherwise, we can't use it. And we're wanting to bring it in 3 very specific circumstances, which are set out here. The first one is if somebody would, if it's looking particularly difficult to do an adaptation or a change to somebody's house, and we think they would benefit from actually moving house rather than having those adaptations done, the scheme is suggesting that we allow the equivalent amount of money that we would have spent on that adaptation to be used to support them to actually purchase a new house potentially, or to rent a new house. The type of tenure that you have for your accommodation doesn't matter in essence. We can still give a grant allocation in any circumstance. I mean, there'll be a number of rules around that, and they're set out within the policy. I don't propose to go through them all in detail in this kind of verbal summarisation of it because people will have read it. But broadly, there are protection mechanisms for the council in there. So if it adds significantly to the value of a person's property, we can put a charge on that property so that could be recovered later, so that people can't profit out of this scheme in essence, you know, that they are getting only what they need to enhance their living as a disabled person. But that's the first item we're trying to cover off, is that ability to actually support a house move rather than to do the actual change to adapt a person's current home. The second one is the one I alluded to at the start, where we are seeing some now that slip above the £30,000 limit. What I should have said at the start is this is a means tested type of support, so people do have their income looked at, their household income looked at, and are only supported if they are in need within the parameters of the scheme. Going above the £30,000 cap, again, there would be a very close look at people's finances to see whether they could afford to do that themselves. But if they weren't in a position to support that, and to be honest, this often happens with children's cases coming through as well, where we need extra rooms in a house to cope with a child with learning disabilities or with autism and things like that. We do get close to exceeding the £30,000 cap. Again, this would allow us to go over that within rules and assessment of the situation. And then the last one is that the means test itself is quite punitive in this area within the rules we're working in. And you do get people in certain difficult situations that, although they may be assessed as being able to make a contribution towards the DFG, in reality, they're struggling to do that. And again, the thing we're asking to bring in here is that we have some flexibility within the scheme, again, within tight parameters and assessments. And we do look fully into people's finances, but that we could waive some a part of the means testing through this discretionary policy. So in summary, that's as far as we're looking to go with the discretions at the minute, but that would be extremely helpful to deal with some of the problem cases we've got at the minute. The alternative, if we don't bring this in, is generally either within children's services or within adult services. Then we have to access care management budgets to top up these these solutions that we need to get in for people. This would allow us to charge it against this grant stream, this capital grant stream, and free up the resources for adults and children's services to be used, in supporting other vulnerable individuals within that environment. And that's probably all I was going to say in summary, Chair, unless there's any queries or comments at all. Thanks,
Neil. I'm sure there will be. I think it's an excellent report, and the flexibility it gives for mean testing is going to be fantastic for our residents. And even on the human resources, I think it makes that department much more efficient. But we will open it. I'm sure there's bound to be a lot of questions. Can we open it up to the floor? Anybody with? I can't see any questions. Heather?
I can't see any, Chair, no.
Great. As I say, I think it's an excellent report, and it's great for our residents. A lot of it makes a lot of sense, common sense as well. So thank you very much for that, Neil, and good luck with that.
Appreciate it. Thank you.
Thank you, Neil. Right, item 6. We have Jim Brown here, who's taking the place of Liz Morgan, who's at another 2 or 3 meetings, I think, this afternoon, to give an update on the COVID, which, as we all know, has changed dramatically over the last few days. So, Jim, can we just carry on, Jim?
Thank you, Chair. Thank you. I'll keep this brief, but like as you say, things seem to change by the hour, by the day, for sure. As you all know, we're moving into national lockdown as of Thursday morning. I think we obviously need to see some of the legislation and the finer details, although guidance has been published online. So we'll move from current alert level of high, and I guess much of what we'll prepare for is coming out of that national lockdown and being as well prepared as we can be if and when we come out of that on the 2nd of December. I mean, after very steep increases in 7-day rates of COVID infections in Northumberland throughout September, we saw things stabilise throughout most of October. We've seen slight increases, I guess, towards the end of October. So in the past 7 days, as up to the 31st of October, we'd had 612 cases, and that's a rate of 191 per 100,000 population. And that's highest certainly in the southeast of Northumberland, but also in the areas adjacent to Tyneside, so Ponteland, Prudder, but also areas up the coast as well. And really, there are no wards that haven't seen cases, but certainly they are fewer further north and further west. I think what's worth pointing at, I think 2 or 3 really important things are, first of all, that we still have the lowest rate in the northeast, but we also have the lowest positivity rates. That's a proportion that are of tests that turn out positive, so around 8.7% for both the ones done in NHS labs and the ones done in the commercial labs. We saw a slight reduction in the numbers of people being tested over recent weeks. There's a number of reasons. We weren't sure whether that was due to data flows, but also certainly to do with some of the changes to the system to discourage people who don't have symptoms from getting tested, or whether it's due to a genuine reduction in people developing symptoms. But it hasn't been a substantial decrease, and we're monitoring that very closely. I think one of the other really important issues is that we had seen the increases particularly in younger age groups, particularly in the 16 to 29 age group, and that's kind of dropped down. We're just starting actually the last couple of weeks to see the small increases in that over 65 age group. Now, compared to other areas of the northeast, actually it's been quite stable for quite a long for quite a lot of September and October. Last couple of weeks of October, we've seen a small rise in that over 65 age group, and particularly in the over 75 age group. And I think that's obviously very important for our most vulnerable populations, who are most likely to have some of the most severe harms from COVID. Which brings us, I guess, on to care homes. We had 11 notifications of cases or outbreaks last week. I'm pleased to say for the majority of the care home cases and outbreaks, I think with the work of the wraparound care homes and care sector group is managing to prevent, you know, increases, I think with the work of the care home staff, but with a lot of support from infection prevention control, the CCG and the local authority. But we have seen 2 care homes that have had a larger number of cases and a number of deaths, which is very unfortunate and very sad, I think, for all involved, particularly, I think, given the visiting policy has been restricted in recent weeks. And I know that all of you will have had a lot of letters around that visiting policy. We have had over the last week a review of that policy regionally. It's somewhat overtaken by events in terms of the national lockdown. We'll be awaiting national guidance, which should be out, hoping, on Wednesday, so that we can kind of review that again as a region. But certainly what we're really aware of is trying to balance between the risk of introducing infection, although we recognise that relatives are relatively small risk if it's managed very well and all those infection prevention control measures are in place, versus obviously the effects on people's mental well-being. So trying to just facilitate some form of safe visiting there. There's another, for care homes, just sticking with the care homes, the care sector, of testing for visiting professionals. So we're part of a pilot that has just started that will be testing professionals who visit care homes more than twice a week and have close contact with residents. So a large number of our community nursing staff, allied health professionals, and some GPs will be getting tested as part of that, and that will probably become a national policy throughout November, in addition to obviously some of the developments around some of the rapid testing for potentially relatives visiting and the visiting professionals as well going forward. A couple of other, obviously schools, we still saw a similar number of cases last week throughout half term. I think a lag from the previous week's testing. So we're still seeing quite a number of cases, slightly more pupils and staff, but still a large number of staff. And they've had a lot of support from our local public health team that are providing, because of the pressures on Public Health England, we've been providing the risk assessment and support for schools in managing those cases and agreeing who are the contacts within support bubbles that will need to self-isolate and other infection prevention control measures that are needed. A couple of other developments. There is, because of, I think, quite a lot of concerns around, I guess, complacency, fatigue, particularly. I think we're all probably feeling that in relation to COVID. The regional comms group are working with a commercial comms group to do some behavioural insights work to really focus particularly on social distancing, and particularly for teachers, healthcare professionals and care home staff who are, really working hard, I think, in terms of in the care homes and the schools and healthcare settings, and wearing the PPE in most cases as appropriate and keeping that social distancing, but particular focus outside of work, in terms of the contacts that they have there. And another development is that there's a proposal from the regional Director of Public Health for an integrated COVID hub that will not only see the Lighthouse lab in Newcastle, which would see 80,000 tests a day processed, but also actually to bring some of that contact tracing regionally. And we think there's so many reasons why that would work very well for the North East, provide a much more personal touch, I think, understand actually some of the issues that people face, and have much better linkage between what's going on in workplaces or care homes or other settings that we're aware of, and really get those links between the contacts and the people who are testing positive, and really try to drive down rates. So I think that's for me. Admissions to hospital is just one final thing, which there has been a small increase, but I think from the reports we get is it remains manageable. At present, there's probably actually a large proportion of the demand that they've seen is from non-COVID conditions. Obviously, the question mark is whether that is a reflection in terms of the lack of access to care throughout the first wave, and whether we're obviously having to manage that. But obviously, they've remained open to elective care, which is obviously different from some other areas. You've seen James Cook down in Teesside that has closed some elective care, but at Northumbria and Newcastle that remains open, hopefully for the foreseeable future. We're also seeing quite a lot of demand within general practice as well. Okay, thank you very much for that. Any questions?
Thank you for that, Jim. Are there any questions from councillors on the floor? Surprisingly, I can't see any. Heather, do you?
No, I can't see any neither.
Great. A great report, Jim. Thank you very much. It must be a changing by the hour, I would suspect, situation. But thank you very much for the report and the clarification. I don't know if you want to stay because the next report is linked to yours, so if that's okay. Thanks very much, Jim. Right, we go to item 7, which is COVID recovery report. Kath is taking this one, and I think a little bit what Kath will be saying has been superseded, but Kath?
Yeah, I think it's probably fair to say that Jim has identified most of the areas that I would have spoken about in relation to the COVID recovery report and what is relevant to the Health and Wellbeing Overview and Scrutiny Committee. The COVID response recovery report was presented to Cabinet on the 13th of October, but since then the situation has changed quite significantly, and as we've been saying throughout the whole of the COVID pandemic, it's always very fluid. A lot has happened in a very short space of time since that report was published. At the time of writing the report, we had local restrictions in place, and we were just kind of getting to grips with what those local restrictions were and whether or not we would be staying in tier 2 or going to tier 3. But as you know, from Thursday, we have got some we've got national restrictions that are coming into place as a result of that. So there isn't really very much more to highlight for OSC in relation to the business of today's committee. Jim mentioned schools, and we are still seeing some demands from our school following the half-term holidays. Local public health teams have been involved in helping support schools, but most of our schools have kind of got into a battle rhythm in relation to being able to deal with cases that come to the forefront and how to manage those cases with just a little bit of additional advice from the public health team. In terms of comms and engagement, there is some regional work going on around some behavioural insights opportunities to look to see how we might try and influence behaviours post-lockdown or post-restrictions being lifted, and Bridges from our comms team is leading on some, has helped to lead on some of that work. Jim's already alluded to the outbreaks that are taking place within some of our care homes, which is extraordinarily concerning, obviously, and we do have our infection control and public health teams who are assisting some of our homes with managing and supporting them in how to access and to utilise PPE in the most appropriate way. Again, Jim alluded to the fact, well, he didn't allude, he actually stated the fact that the restrictions and the visiting for relatives is causing a great deal of distress, and we are acutely aware of that and are trying to find ways that we might be able to safely assist with visiting within our care homes. It is something that I hear about on a daily basis, and we are looking to how we might move that forward in the future, depending on what the national restrictions tell us. And then finally, really, is just the Northumberland communities together are building up to helping to identify and to support those who are clinically extremely vulnerable, and ensure that they are able to have their needs met over the coming 4 weeks or however long those restrictions are in place. So I don't propose to say anything more, but I'm happy to take any questions.
Thanks for that, Kath. Excellent report, but as you say, it's just ever changing. Are there any questions for Kath or even Jim from the floor from councillors?
Yes, Chair, I can see Councillor Lowry and Councillor Bowman.
Councillor Lowry first, please, then Councillor Bowman.
Kath, you touched very briefly on behaviour analysis. my ward is Norham and Islandshire, and we have very, very few cases. A lot of the feeling I'm getting from the ground is that a lot of people are not going to be ignoring this, but are a little flippant, which is worrying for me. And I'm worried that their behaviour might attract a more heavy-handed approach. Have you any thoughts on that?
Well, I've got lots of thoughts. I think the difficulty is that what we're finding is that, you know, as we all know, and Jim would be able to attest to this better than myself, but as we all know, that the spread of infection is a result of human contact. And if we don't adhere to the rules and the boundaries that are put in place, or the advice and guidance that's put in place in order to help us assist, then that will contribute to the further spread of the infection. The behavioural insights work is to look at how we can influence and help to shape behaviours going forward in order to ensure that people do adhere to the measures that are put in place. I don't know, Jim, if you want to add anything to that.
Yeah, I mean, I guess you asked also about sort of enforcement. I think, I mean, I completely agree with what Kath has said. I think this has gone on for a long time. It is difficult influencing people's behaviour at the best of times, you know, particularly when this has gone on and it has such a profound impact on our everyday lives, our ability to, you know, to see our friends and family and those who are important to us, people who live on their own and who are really feeling that. I think there have been a number of issues around enforcement, and I think when Phil Soderquist, who heads up the workplaces and businesses, and has worked really closely with police around sort of enforcement around some of the licensed establishments, the hospitality venues, and I think work closely with the police just to make sure that it's you know, it's proportionate. I think we'll need to just see in terms of the enforcement what you know, what the exact legislation says, and obviously work closely with them. And I think a lot more of it needs to be obviously very positive. I think some of the work that we're doing with care home staff is just really just trying to thank them for the, you know, actually immense sacrifices they're already making, you know, and to support them to, you know, continue to, you know, to socially distance, you know, at break times and outside of work, you know, because of the vulnerable nature of the people they're working with. So I think that's what it's trying to find out the best ways, do the focus groups, the surveys with the people that are really on the front line to work out how best to influence behaviour the most effective way.
So we would always want to influence rather than enforce. I think enforcement, when we get to enforcement, it's always as a last resort, really. We would always want to be in a position where we're influencing people's behaviour, because enforcement, it you know, has so many more negative connotations than the influencing and helping people to adhere to the guidance voluntarily.
Thank you.
Thanks for that, Kath and Jim. Councillor Bowman, please.
Thank you, Chair. I've had a resident who's come to me this morning asking about support for new babies. She's telling me that all the support that would normally be in place is actually not in place, and very little is actually coming through from the NHS to well, mitigate from COVID-19 transmission. She's very concerned about mental health issues, postnatal depression, and those sort of items. And it just brought to mind how devastating the situation is. And I'm trying to fathom out which way and which direction to advise this young mother. Can you give me some assistance?
So Les, there is a number of support services that are available across the county. I'd probably need to understand a little bit more about what this particular person's needs are, or the particular support this person needs. So I'm happy for us to have a conversation offline, or for me to ask somebody to contact you to have that conversation, because it will be dependent on what type of support that person is seeking.
Are you happy with that, Les?
Yeah, I'm happy with that. Thank you very much.
Thank you for that, Kath.
I like the severe situation that we are facing. Thank you.
Yeah, Councillor Hutchinson. You need to unmute.
I normally hover over the mute and move the mouse. Kath, could you inform me, are there any more testing centres going to be made, like permanent testing centres? You've got them in Blythe and Ashington, and representing from the west of the county, it's a long way from Haltwhistle to go to get tested. And Haltwhistle is one of the most deprived areas, along with the southeast, in the county. And just for people to afford to be able to travel on public transport to get to them. So are there any chances of Hexham or Berwick, other places like in the outback?
So as you know, we don't control the testing sites as a local authority, but I know that Jim's got some information that he might be able to assist with in relation to where the potential sites might be going forward.
Yeah, Jim, you had your hand up there.
Sure, thank you, Chair. Yes, there are plans very imminently to have local testing sites at Berwick and Hexham, and there will be mobile testing units sites identified for all the market towns. I mean, there are quite a number of mobile testing units already in operation across the county. So it's obviously, very important that they are that they're only there when they're used. But obviously, the mobile testing site units are around. If we're seeing increases in numbers, in rates, then they can be deployed, rapidly. But certainly, Berwick and Hexham are imminent. I don't have exact dates, I'm afraid.
Thanks for that, Jim. Ian, did you want to come back on that?
Yes, thank you. So could the mobile unit be deployed, once a week or once a month or something in Haltwhistle for that rural area? As I've been told, some people are finding it difficult to be able to get even to Hexham.
I mean, like I said, all we can do is influence. Where these are, they will be looking at the rates of infection and moving those units accordingly, and they get moved into the areas that have the highest, rates. So we'll bear that in mind. I'll feed that into, the links that we have with the Department of Health and Social Care around testing, around your concerns around Haltwhistle. But I regret it's one of those, those issues that, at the moment, until we get that much more regional approach, it's not quite as much within our control. But I think
it's about identifying what the need is in individual areas. So if there looks like there are rising infection rates within that area, then it is likely that we will be able to influence where those mobile testing sites are, including the likes of Haltwhistle. But if there are only one or two people who need a test, then that makes it a little bit more difficult to influence that. But as Jim says, part of a regional approach to testing, and we will have more testing sites come on board as time goes on.
Thank you for that. Fortunately, Haltwhistle hasn't many actual cases. It's just the testing.
Yeah.
Hope it stays that way. I hope it goes away. Thank you.
Thank you, Councillor Hutchinson. Thanks, Kath and Jim, for those answers. I can't see any more hands up. Heather, can you?
No, Chair.
If there's no more questions, thanks, Jim. Thanks, Kath, for that update. Item number 8 on your agenda, Foundation Newcastle NHS Foundation Trust Quality Account. You will have received an update of the presentation this morning. I couldn't really see much difference in them. But Chris, who is taking this now, have we got?
There was supposed to be somebody from Newcastle Hospitals coming to present, but they've been in touch to say they're having IT issues and won't be able to present it this afternoon. So I'll get in touch with them and try and reschedule a date for them to come and present, ideally in December, along with NIAS. But they're not here at the moment, I'm afraid, Chair.
No, I thought I saw them sort of coming in and out, but thanks for that, Chris. So we will come back to councillors with a new date for that, and hopefully it will be the December. Going on to report from Scrutiny Officer, Chris, I think this will be you again. The work programme.
Yeah, work programmes there, you know, as always, if members have anything they wish the committee to consider, they just need to let either myself or the chair know. There's obviously the NIAS quality accounts next month, and I'll speak to Newcastle and try and get them rescheduled. There's also a report coming next month on Northumberland Communities Together, which is covered briefly in the COVID recovery and response report that we've already had. This will be a more in-depth report, and that'll be coming in December.
Excellent, Chris. Any questions or queries on the forward work plan? I don't see anyone. Urgent business, I don't have any, and I don't see any hands up. So thank you very much, councillors and officers, for a good meeting. And the next meeting is Tuesday, the 1st of December. Thank you all for taking part, and please all take care. Thank you.
Thank you, John.